Assalamu alaikum. Today the topic of our video is anti-tubercular drugs. The first of them all is group rifamycins, which includes rifampin and rifabutin. The mechanism of action is that they inhibit the RNA polymerase, thus less proteins are formed for mycobacteria to survive. As the normal mechanism is DNA, it transfers its information to messenger RNA via RNA polymerase, which then interacts with the ribosomes and make particular proteins. So when rifamycins, they inhibit RNA polymerase, it is inhibited, no messenger RNA, no interaction with the ribosomes, and no particular proteins are formed. The adverse effects of rifampin are red-orange urine, which is one of the most important adverse effects. False positive urine, opioids, nausea, vomit, rash, and less concentration of particular drug you are taking it with. Why? Because it is CYP450 inducer. The second drug is isoniazid. The mechanism of action is that isoniazid is taken up into the mycobacterial cell wall and then converted into an active metabolite by enzyme catalase peroxidase. Now, isoniazid binds to NAD in mycobacterial cell wall, forming INH-NAD complex. This complex inhibits enol reductase. And what is enol reductase? Enol reductase plays an important role in synthesizing mycolic acid component of the cell wall. So when the mycolic acid is reduced, it means that an integral component of cell wall is reduced. Thus, the bacteria dies. The adverse effects of isoniazid include increased LFTs, metabolic acidosis, which can be ketoacidosis or lactic acidosis, drug-induced lupus. B6 deficiency leads to peripheral neuropathy and anemia, most specifically sideroblastic anemia, seizures, convulsions, rashes, and fever. The next drug is pyrazinamide. The mechanism of action is that it reduces mycolic acid synthesis by inhibiting the enzyme fatty acid synthase. The adverse effects of pyrazinamide are that it is hepatotoxic and it causes hyperuricemia, that is, increase the uric acid. The next drug is ethambutol. The mechanism of action of ethambutol is that it inhibits the enzyme arabinosyl transferase. What arabinosyl transferase does is that it takes two molecules, namely arabinose and galactose, and incorporates them to form arabinogalactin, which is an important component of mycobacterial cell wall. So when ethambutol inhibits this enzyme, it can no longer perform its action, and thus the integrity of the mycobacterial cell wall further weakens. The adverse effects of ethambutol are optic neuritis, which is one of the most important adverse effects asked in the examination. Optic neuritis mainly includes diminished visual acuity plus inability to distinguish between red and green. And secondly, ethambutol also causes hyperuricemia. Now, these were the four major drugs of TB, which go by the mnemonic RIPE, R-I-P-E. Some of the additional drugs are dapsone. The mechanism of action is that it inhibits the enzyme involved in conversion of PABA to DHF, thus less incorporation into DNA and less proteins are formed. The next drug is streptomycin. The mechanism of action is that it binds to 30S ribosomal subunit and inhibits the interaction with RNA. Thus, the proteins synthesized are less. The adverse effects of streptomycin are that it is nephrotoxic, ototoxic, and teratogenic, and one of its contraindication is in disease myasthenia gravis. All of these drugs are used in a proper regimen. If we have latent TB, isoniazid is used for 6 to 9 months and rifampin is used for 4 months. And for active TB, we got two phases. One is first regimen, one is second regimen. First regimen, we call it initial phase, and second regimen is a continuation phase. In initial phase, we use all the four RIPE drugs, which is rifampin, isoniazid, pyrazinamide, and ethambutol for 2 months. And in continuation phase, we just exempt pyrazinamide and ethambutol, and we continue rifampin and isoniazid for further 4 months. We supplement it with B6 supplements in case of deficiency due to isoniazid, and plus minus streptomycin if the TB is TB meningitis or miliary TB. This was all for one of the most important topics in medicine. In case you also want to see additional information about multi-drug resistant TB and extensive drug resistant TB, you can watch my another video which has already been uploaded.